So I'm going to start off tonight just by giving you a little background about PT. My name is Love Kingsbury, and I am a family support specialist here at PT, and I want to thank you all for being here tonight. I want to tell you a little bit about who we are and what we do. So sometimes people decide to join webinars and they may not know anything about the organization that's hosting. So I'm just going to take a couple of minutes to go through it. So PT stands for Parent Educational Advocacy Training Center, and we are a statewide nonprofit. And our passion is to empower families of children with disabilities in Virginia. We do service Virginia's Parent Training and Information Center, and we've done so for more than 40 years. Our central focus is on families who are navigating the special education and disability service systems. And we do have specific targeted areas of outreach because we recognize and understand that the populations you see on your screen may face additional hurdles in accessing services within their communities. So like you see on your screen, it's Latino outreach, military outreach, family engagement, transition to adulthood, bullying awareness, and early childhood. So as Virginia's PTI, it is our responsibility to meet the needs of families throughout the Commonwealth, and PT is able to do so through our satellite offices. So what you see on the screen is the way Virginia is divided up into the 8 superintendent regions of the state. And so within PT, we do have staff in the majority of regions of the state. We do have 2 main offices. One is in Region 4 in Warrenton, and the other is in Region 2 in Suffolk. Nancy and I both happen to be in the Roanoke area, so we are representing the western side of the state. So how we provide our services is we are able to meet those needs using a variety of methods. I spend the most of my workday on the telephone or emailing, providing individual assistance to parents and the professionals who also work with children with disabilities. So we also conduct webinars and workshops, and we also offer larger statewide trainings in person and virtually. And then we have a large 1 to 2 page fact sheets about all different types of subjects having to do with special education and transition services and early childhood. So with that, I do want to thank you so much for being with us tonight. And now I'm going to stop that share and I'm going to introduce our wonderful presenter for the evening. So, if you were on earlier, you heard me say that sometimes people get involved because they have a personal connection. I know Nancy because I reached out to her because I have a daughter who is a drug addict. She is currently in recovery and has been for quite some time. But Nancy really helped me in a space and time when my life was pretty dark. And my daughter also has disabilities. And so it was a difficult time. And when I thought about this workshop, I really thought about somebody that I knew understood and could really be on the side of parents who need this information. And so Nancy has all kinds of different things behind her name and that make her special, but really what makes her special is her ability to help people when they need it. So I'm so thankful to have Nancy here tonight, and I am going to now attempt to share screen. So let's see. And I apologize, we may share a screen. It may not look that pretty, but it's going to do the job. Mm-hmm. Okay.
Looks great.
Okay, good.
Good. So, Love, I'll just tell the folks, it looks like we have about 11 participants. I would love it if maybe you can give me the feedback later about where people are from, because I'm assuming they're not all from Roanoke. If they are, great. But if they're from other parts of the state, that'd be awesome. Just a little bit about myself. I actually have figured out that this school year is the 44th year I have been teaching somebody something. So I came from Maryland to Roanoke in 1999, and I was teaching special education starting in 1979. special education for those 20 years. And I actually went to Towson University for my undergrad in Loyola. And I remember I was following my mom's footsteps into teaching. She had just left Towson by getting her master's degree as a reading specialist. And then I went in, and within the second semester there, we were told that 94-142, which some people may know, but that's what I totally remember from 44 years ago, that particular law was going to help with making sure that every single child was educated. So that's a long time ago. And I ended up doing that for first 20 years. And when I came here, I met a woman that was working with Roanoke County, and we started a nonprofit that previously was called Prevention Council. We were funded by the Drug Free Community Support Grant out of the White House. There are thousands across the country, and we are now almost 23 years old. During COVID, we were able to sort of rebrand, reboot, and we are now Partnership for Community Wellness, because this is about the road to recovery and what that looks like for individuals in wellness. And I am still serving Roanoke County as a surrogate parent for those students that no longer have a parent. They're usually DSS students. And so I serve as a surrogate parent in the cases where they need me. So I still love to teach anybody anything. So this is sort of part of what I do. We go into the schools, we talk to the children. And if anybody is not from this area, we have coalitions around the state. So just let me know. You can contact me individually for any of those kinds of resources. And we did, our council did help grow the, it's called CECOVA, Community Coalitions of Virginia. And that actually is done statewide. And we'll be having a statewide summit here in Roanoke on October 23rd. It will be around prevention, substance recovery. So Love, I can send that information if anybody would want to attend, because that's for anyone, even parents. And we did this in 18 and 19, and of course we're shut down from COVID, but there were parents that came to that just to learn more. So
yeah, that would be great.
Yeah, so go ahead. This is who we are. I'm the executive director. Lee Stover is communications grant coordinator. We have a lot of volunteers. We actually have 2 part-time positions that just opened up, so we'll be filling those. But again, we have grown this from just 23 years ago. The whole purpose was to get kids as close as we could to 21 and help parents understand that drinking underage was impacting the brain. And we were also trying to get kids never to pick up a cigarette. And now you can see that it is completely different. And we have all kinds of things that we are trying to prevent, educate, and we work very closely with peers in recovery too. Go ahead. So this is how it started. I'm going to give you these stats because we do work with Virginia Tech. And we have a Virginia Tech professor and one from Radford University. They actually were the original team back in 2001 when we were putting together our very first data set. It's called the Youth Risk Behavior Survey. If you're here in Roanoke, in the county, we survey every single 6th through 12th grader. Parents do have the opportunity to opt out. That's not a high number. Because what we need is data to know what we need to do with programming. So this is alcohol numbers from basically 20 years ago. 45% reported using alcohol 30-day use. And you can see that we targeted that and we continue to with education and prevention programs. And that has dropped to 19%. So this is probably the biggest story. I'm going to assume that many of you have heard of Dope Sick by Beth Macy, and we have an incredible story to tell in this valley as to how that happened. Beth actually contacted me in 2012 because she was going to do a story about what happened in 2010 and these two young men are in the book, about what Spencer Mumpower had given Scott Roth the lethal dose of heroin 2 years before. We did not know anything about this. It came out with Beth's first article. She had a 2-part article. I actually knew, the Mumpowers. My son had gone to school with Spencer, and then I would come to find out that my oldest was friends and was in class together at Hidden Valley High School with Scott Roth, and Scott Roth lost his life to this. Over time, the story continued to grow, and we now know the latest Netflix is the one that's called Painkillers. It's very riveting, and it's something that you can watch, and it is quite true what the pharmaceutical firms did. So it came in, it was like the Dementors in Harry Potter. Completely, we had no idea that this was going on. And by 2014, across the valley, high schoolers said they had tried at least once in their lifetime heroin. You can see what we did here. By 2016, we made an all-out effort with law enforcement, all kinds of partners, to start community conversations. And we actually are starting that back up next month. It's being led by Judge Ballou, who is the Western District Judge that was appointed by the federal government, the Senate, and the House recently. And then we're working with our Commonwealth attorneys, and all of these this time will be in faith-based communities, churches, to see if we can get more people, because this is now, there's still heroin, but what's even more is there's fentanyl, and now the latest new drug on the streets is called xylazine, and I'll give you a little bit more information about that. So this is what we do, and when we have data, we can then see where we have to target things. So we're very proud of getting this down. However, things just keep popping up. So, okay. So our brains aren't fully developed until at least the age of, go ahead, 25. And to be honest with you, we have a research institute here that we work with, and Warren Bickel, who's been here since 2011, will tell you that there is new research that really says parts of the brain are not fully developed till 28, 29, 30. So I think that one of the biggest things I like to get out to all caregivers of kids, teens, and young adults is this is all brain-based. And the more that they can help them understand that, the better off things can be. Because it just, and we know that there are still parents that think, well, I got through it. I was 16 and I'm still here. And we just can't go down that road anymore. We've got to use common sense. And you can see that source is commonsensemedia.org. That is one of the #1 resources I point parents to, and it is on the resource sheet that Love will be sending to you. Go ahead. So over the past 2 years, and this is very tied to what's going on in their lives. So we know that kids are connected in person, but then they had to really connect to COVID through the screens. And just know that this is very much a part of possibly kids starting to use or experiment, because they don't have to call on the phone. They don't have to be in person. They can just connect through the internet, and one click could get them a pill that could possibly have fentanyl in it. So this is where we really need to understand that the earlier kids get phones, the higher the parental oversight has to be. We continue to say we follow Wait Until 8th, and that is another nonprofit that moms put together in 2017. They are on social media. We really tell parents, please, please do not allow this kind of all out in elementary and middle. And I realize that, with kids with disabilities, special needs, that you have to really look at what is the age, and then you will have to do this jointly so that they are being kept safe online. Go ahead. Overuse in screens for kids and adults can lead to all of these things. We know that, and we continue to have to really talk to kids about this. We started going back into the schools this past semester, and I will tell you that over 50% of the kids were coming into the schools really without anything in their stomach. They hadn't had any water, and we really had to take a step back and say, your brain and your stomach connects. Everything is about the brain. And, this is where teachers and administration have to do what they can to help kids be ready to learn. And these are the kinds of things that happen, especially when kids are allowed to have their phones in their rooms and use them for alarms. I really do tell parents, if this is going to be a struggle, or if this has become a problem, you really need to say, okay, we can go get an old-fashioned alarm clock from Walmart. So go ahead. And these are some of the other impact that are created over a lifetime. But I think we ourselves can say that if we've been on the phones, if all of this can be something that even we as adults have the impact and have experienced if we're on that phone too much. Go ahead. And these are definitely all connected. Substance misuse and addiction, decreased potential, increase of suicide. I mean, this is never going to go away, and we're going to live in this world, but we've got to find out how we can live in it with boundaries for ourselves, let alone our kids. Okay. So this is the increase to digital world, increasing access to this. Now, I could do a whole presentation on what's going on with the fact that on July 1st of 2020, our legislature said yes to legalizing marijuana. But I've got to tell you that the only three things that are legal are that you can possess up to an ounce 21 and over. You can grow up to 4 plants if they are tagged in your backyard and there is a high fence around them. And you can have this in your possession. However, you cannot sell it, which we know that's happening. You cannot sell it. You cannot use it out in public, which we know that's happening. And certainly you can gift it, but there can be no means of back and forth. And you're not supposed to be driving with it, which we know this is all happening. So the biggest thing right now that supposedly went into law on July 1st of this year is that all of the hemp products, the Delta 8, anything look like gummies, animals, anything that would target children was to be taken off the shelves at all of the convenience stores. We have 16,000 convenience stores in the state of Virginia. And interestingly enough, this all lies under the Virginia agriculture group. Okay, so they don't have a law enforcement. We know that this is not happening easily. I was told today that 11 shops out of 16,000 have done something. And what happened just this last week, I got a call on Saturday morning from one of my board members that a mom she knows, her son, 17 years old, was able to purchase at a convenience store here, very prominent one, on 419 across from Tanglewood Mall. He was only 17, was able to walk in, ask for a couple of vape pens, and he was rushed to the hospital. He actually just got out of the hospital. We have no idea what's in this stuff. We are working very closely with Dr. Michelle Peace out of VCU. She has a grant through Virginia for Healthy Youth, and we are hoping to get school systems to give back to her confiscated vapes, pens, anything, so that they can be tested to see what's in them. She is another incredible source that would do a program just about this. So knowing this stuff is very, very important. I did get a call from a mom last week, didn't know what a dab pen is. So dabbing is the highest concentrate of marijuana. Dab is sort of like the old, a little dab will do you. And it may go by shatter, it might go by butter, and you heat up the THC to its highest concentrate, and you're talking about concentrates anywhere from 69 to 97%. So these are all different ways to look at this. When a child or teen is saying that they're vaping, or a parent calls me, I ask them, what are they vaping? Because most parents, I think, still think of Juul. That's not what you should be thinking about. You should be thinking about that it is THC, that it is something that is not even part of THC, may not be Delta 8. There's now Delta 8, Delta 9, Delta 10, Delta 10, 9O, Delta 11. So you need to really find out, because most of this stuff, it is still legal. It is still not regulated. And that's the biggest thing I can emphasize, that it is not regulated. So even for adults that may think that things are going to help them, nothing is regulated yet in the state of Virginia. And that's a huge mistake that the legislature's made, that they didn't regulate anything and they just let the train leave the station and it's running very quickly. Okay, next slide. So I don't know if any of you have seen these, and some of them look real and some of them are not. So if you see in the corner of the Doritos, it says THC over to the left, then it has a triangle. You'll see that it, if you were able to see those packages, it has like a marijuana leaf. It says CA, California underneath it. This is what came in full force by August of 2021. So a young child here she was 2.5. Some Apple Jacks that looked like Apple Jacks got in a swim bag. She ended up eating some at some point in September of 2021. And then I got a call that this was happening. Took about 32 hours at Crillian for her to come out of what was happening. They couldn't pump her stomach. She continued to have all the way up to 6 to 8 months later, terrible dreams, things feeling like it was crawling on her body. So she was still having these reactions. We did send the rest of it to Michelle Peace at VCU. They tested it 4 times. It was not Delta 8. It was absolutely pure Delta 9. So, and I don't know if you heard that up in middle part of Virginia, a mom allowed, she was someplace that she had an entire jar of gummies that she had purchased, supposedly Delta 8. Her 4-year-old got a hold of that, ate a lot, and he lost his life. So she is facing jail time for that happening to her 4-year-old. That was just I think it was last May. Okay, next one. This is the one that we are extremely concerned about. This is fentanyl. Fentanyl is basically in everything. And we will, in our community conversations, we will be talking about this. And it is extremely concerning because they just don't care. There are street chemists out there. This is coming in from Mexico, China. It's coming in fast and furious, and they do put this in everything. Now, Love, that is about a 6-minute video. And if you're going to send these out, that's fine. If they want to look at that or they want to go to Natural High. I think also we put that on the research. Yeah, the resource sheet has hot links. That's the Natural High. And then there's some really good information under fentanyl awareness from the DEA. And there's, we will also add, I sent another resource for Parents Against Vapes, and that holds some really good information too.
Yes, tomorrow I will be sending an email out to all the participants, and it will have all of the information.
Okay, and we're using that one particular naturalhigh.org. we are using that in classrooms, middle and high school, and the kids are really paying attention to this. I mean, they're very concerned because this is where, and another one is called Charlie's Song, Love. I can send you that. That is a couple that lost their son Charlie around Christmas time, probably about 4 or 5 years ago. And the issue with fentanyl is it could be in one pill, tiny, and then the next pill, it could be more and enough to do an overdose. The same thing goes for a joint. We know stories of people sharing joints. Somebody overdoses, the other person does it because this again, it's nothing's regulated and it's coming in to really make money. Okay,
Right.
go ahead. These are the faces of fentanyl, sort of like we talked about the faces of heroin. And again, this is, these are young people. And this is where we're very concerned, even at a federal level. Nora Volkow, who heads up NIDA, she, when we go to conferences, she's an incredible brain researcher. And she continues to say that we are now concerned that even if kids are wanting to experiment as an adolescent, even experimentation could cost a life. So talking early and often about this is the most important thing that you can do. It can start as early as you have prescription medicine. You let your child know that this is specifically for the person that has the name on it, that you're going to lock this up, that you cannot take other people's medicine. To be honest with you, we say this all the time, and some of the adults get a little squirmish because holding on to medicine that was prescribed to you in the state of Virginia, if you share that, you have committed a felony. Now, people aren't coming around into your houses, but just so you know that, that's the law in Virginia. But we truly have resources that we can take into elementary schools so that kids can learn about this through health classes or science classes. This is just amazing what has happened because this fentanyl is just in everything. Okay. Recognizing the effects and take action to protect their brains now is crucial. I was on a Zoom today. There is an organization that's called Rescue. They do a lot with asking for doing focus groups with teenagers and how do we get them to respond. And I think that the biggest thing we can do is give them information, and then there's always going to be a why as to why this is happening. And for some kids, it's they want to be part of a group. They want to be part of something that's going to make them feel like they have friends. But that's where I think navigating this, and I realize that, we're doing this and we're talking to parents that have kids with special needs, disabilities. But in all honesty, this is what every parent should be doing. Every parent should be having these early talks, should be finding out as much information as they can, especially if these kids are allowed to be online, if they're communicating through a phone, because all of this is having to navigate with your child, with your teen, and what is really going on. Sometimes it's, what comes first, the horse or the cart, because this can very quickly turn into, I need that for anxiety. I need that because I don't feel like I fit in. So again, these are talking to them about what it does, especially early, so that they can know that this brain, this healthy brain needs to be completely free of anything that is not prescribed to them for a particular purpose. Go ahead. What can you do? Understand protective factors can provide alternative to screen time and increase overall wellness. I am continually saying some things that we messaged 10, 15 years ago. Silence isn't golden. It's permission. We've got to talk about this. And when there have been many parents that have told me this will never happen in my household, this is what we do to protect our kids. Once you say this will not happen, your red flags go down. So what we need is to be even more vigilant. And there's plenty of information out here, much more than we had even 10 years ago. And I think having it, and then you as parents, caregivers, linking arms with others. I always have told parents, you know, once they go to middle school, there's a whole new set of parents you have to meet. Once they go to high school, a whole new set of parents you have to meet, because you have to know what's going on. And I constantly am asking kids, especially teens, do you have a plan with somebody? Do you and your parents or your caregiver, your grandparents, do you have a special code so that they can help you get out of a situation? And I say to parents, you're going to have to really be calm if they end up someplace that you didn't give permission, and then allow them to come home. And you may or may not want to discuss it right then and there, depending on the emotions. But definitely you want to discuss this, and you want to know the whys of what happened and how they got there. Go ahead. These include exercise, family time, in person. These are all the protective factors. And it is about constantly having conversations. And it is now about putting the phones away, having those boundaries, we are really big on helping parents know that you can ask kids, okay, you want a phone? Then you start to write the contract. And you want this, you want to have more free time, you start to write the contract. And then it's a discussion about what are going to be those consequences if this part of the contract isn't followed. And certainly in the end, parents are the ones that get to have the last word on the contract, and then it's signed and it's put on the refrigerator or someplace where kids can actually see it, so that this isn't a constant fight. And that can be about any of these behaviors that need to happen, you know, throughout the fact that they're elementary, middle, high school, and even on into teenage and college. A lot of parents say, well, they're now in college. I definitely ask, who's paying the bill for college? Because a lot of times parents sort of start to step back, and we have to remind ourselves their brains are not fully developed till somewhere between 25 and 30, and it could be longer than that. Okay. This is a great book. The Addiction Inoculation, Raising Healthy Kids in a Culture of Dependence, is a resourceful book for anyone with kids in their lives. This is by Jessica Leahy. I listened to it on Audible. She does do presentations. She's out of the Northeast, and she talks about her own addiction raising children. It was addiction to alcohol, but it is a great, great book about inoculation and how we can dose out that inoculation, you know, through the lifetime, the span of time that they're in our homes and all the way into early adulthood. Go ahead. What can you do? Understand, learn. Go ahead. Again, know how long your child's using the screen, what they're doing on the screen. There are so many different emojis that are connected to substances, to drugs. You can find these things online. We can send more of this information, but again, this is about parents having to really, really know what's going on with behind those screens. Go ahead. Screenagers. So this is another incredible resource. Screenagers, they just came out with the next part of their series. And this one is about technology impacts development and mental health of our youth, and also substances. So this is by a doctor. Her last name is Delaney, and you can get weekly emails from her. She talks about all of the things that are happening in the world just today, but she actually did this documentary, and I think this is the third one, maybe it's the fourth one, because they were having, their oldest was going to become middle school age. She is a pediatrician. It's a wonderful, wonderful documentary that she's putting this out in parts. And the latest one is around screenagers and screens and how that impacts them when there is substance use also going on. And that's a hot link on here too. Okay, protect, understand, learn, protect. Go ahead. So this is something new, Love, that we just started during COVID. We are partnering with a company here, Lovo Learning, to develop a learning academy, and we'll cover topics like digital wellness. Right now, we are They are creating modules of about 10 to 15 minutes on THC, fentanyl, and resilience. And we'll be able to send that out to you and share it out with other organizations and parents.
Oh, thank you. That would be amazing.
Yep. This is what it provides: accessible, actionable wellness knowledge and localized resources for parents, caregivers, educators, and it'll be on this online platform.
Okay.
They're interactive lessons, printable resources, and note-taking ability. And so we're reviewing the research, and then you can determine what your role is, and we evaluate and practice it with your children. So one of the things that SAMHSA, who is one of our funders, SAMHSA has something called Talk, They Hear You, and it's on that resource page. This is an app, and you can actually use this app to practice what you're going to say to your kids. They have amazing videos on how to talk to your kids. And again, SAMHSA has really been probably our largest longtime partner. That is the Substance Abuse Mental Health Association up in Washington. It's national, but they have developed really, really good tools for parents. And I highly suggest that you get the app. It's real easy. Go to the App Store, and it's literally Talk, They Hear You. And you can get the app and use it every day.
Okay.
Research shows meaningful wellness care mitigates risk, leading to increased resiliency, sustainable, positive generational change. And that's the other thing, is we really need to try to cut through that generational change, because sometimes that is what keeps happening with those that may end up with substance use disorders and not understanding that this is a disease of the brain.
Right.
Okay. And then this is, again, more research that says you and your child matter. Navigating the maze of adolescence safely is hard. So we are trying to provide that you don't have to do it alone. So these are some of the national resources. I don't know if anybody's heard of Johnny's Ambassador. We actually had Laura, his mom, come here. He lost his life in 2019. She's all over the United States. Sextortion is a whole nother topic. And then Operation Parent, again, these are all on here, and they are linked. They're hot links on the resource page that you'll get. Next one. Okay, then, sorry, go back. That was the ones that here. Sorry, can you go back, love?
Yeah.
So Community Coalitions of Virginia, I did mention that is our statewide coalition. If you are here in Roanoke or even in the surrounding area, the Hope Initiative was founded in 2016 for those that needed help to find their path through recovery and to treatment. It sits in the Bradley Free Clinic. If you have read the book Dope Sick, Bradley Free Clinic executive director is Janine Underwood, and she lost her son in 2015, 10 years after he graduated from high school here, and he went to WVU, and by 2007, he had a snowboarding accident, and the doctor there in that area gave him 90 Oxycontin, and that started the road. He actually was in and out of whatever there was treatment back then, came back, was able to find someone that would hire him. He had a felony, and he was back in the spring of 2015, and it only took one time. And June 6, 2015, he lost his life because he had relapsed. And there weren't these resources. There just weren't these resources. Roanoke Valley Collective Response, this was created 2 years after Hope. We have over 200 partners in this. They are now grant funded. Anyone can join, and we look at all of the pieces from prevention all the way through recovery. And then their peer recovery network is amazing. It has grown. Bailey Helgeson runs that, and we bring peers into the high schools. Many of them went to that high school And it is amazing how the kids will sit and listen to those that have sat in the seats before, and what happened and what was their story. A lot of times it is about anxiety. It is about not feeling like you fit in, and taking a pill that's going to make you feel better. That was one of the stories from one of the peer recovery specialists that came back into Hidden Valley. He now is a peer recovery specialist in North Carolina, but his story was that he had an injury from soccer back in 2007. He said, I took that one pill, which was an oxy, and I told myself, I want to feel like this for the rest of my life. And that was his start of the disease of addiction. Okay. And this is how we are together. We're here to help with resiliency, coping skills, self-care, support from others. That particular TED Talk we also show that. That's one that you can, open up and see. It is actually a little girl that's telling adults what they have to do to protect the kids and their brains. It's very cute TED Talk that even the kids like. So this is where we have to find those protective factors. Something that I always sort of try to make an analogy to, we're all taught now to wear sunscreen to protect from all kinds of different cancers. And there was, way back in 1999, a song that was very popular, and it was titled Wear Sunscreen. And it's just how many protective factors can we put around our kids? And that's what we have to think about.
All right.
Okay, this is what's coming up. If you're here in Roanoke, we have this is Recovery Month all month. Our next big event is Strong Fest. This is actually people that are, lifting, and we're making it a family affair. But the stories that come out of people working out, a lot of people that are in recovery go and get that same type of feeling by working out, which is a much better and healthier way to feel good. And then these are October and November, we'll be doing these community conversations.
Okay.
And this is where you can learn more about us, and you can go to PCW. And thank you very much for, and this is where you can actually see the Academy. Now, they have updated some things, and we're working on a couple of the other new modules. So maybe give us a couple of weeks, and that's where you can contact us.
So Nancy, have you seen, oh, sorry, I'm going to stop my share. And like I said, tomorrow I'm going to send out links with everything in the presentation, and everybody will have everything. But I wanted to ask, and if anybody has any questions, please feel free to chime in. But, I know some kids who maybe have, somebody's offered them a vape, and they didn't even understand that this could even be cannabis. They didn't even know.
Right. So, I mean, and the thing is that, again, I think this is with a lot of kids. Was that a particular age?
He was, I think, maybe freshman in high school.
Okay. So, and again, this is where parents and caregivers need to know about those things so that they can say, here are things that might happen, or what do you think might happen if you're approached and somebody gives you something. And that's where, I mean, some of these kids that have this don't even know what's in it because they got it, and maybe that kid wants to have more friends, or that kid has been told, if you do this, we'll give you this,
Right.
So it's really a matter of doing a lot of role playing, I think, and going from, 5th to 6th grade. That's that middle school. So what are the role playing for kids that you need to really say to them, okay, what would happen if someone said this to you? And doing that more than just one time, and having conversation of what went on at school today. Who are your new friends? I see that one of the questions was here about risk factors specific to youth with disabilities. And I think what those risk factors are is that they may probably be more vulnerable because that processing of understanding or knowing these things, they may not know. So again, this is where, how much are you going to know for these developmental stages? And then that has to even be more for kids that the developmental stage is going to take longer to get to. Does that make
Okay.
sense, Lev?
Absolutely.
Yeah.
Yeah.
And I think it's, I mean, it is incumbent upon parents to think about all the possibilities, because
Right.
I do think that kids with disabilities are much more vulnerable because they want to be part of groups, and they may truly trust more than they should trust,
Right.
and they may not know those questions to ask. And I think setting that up and having the role play go on, and again, that's where, you know, if you go to this, if you have this app, Talk They Hear You, you can just look those things up. Common Sense Media. I mean, this is where the parents have to literally stay ahead.
Right.
And yeah.
Okay. Yeah, I do. I think it's so important to stay current
Yep.
with everything that's out there and what is happening around, because it's very easy. Addiction happens like that.
Right. And I think knowing that addiction is a brain disease, and then knowing if, like, I know that there are cousins on both. I lost one cousin on my father's side to this disease 10 years ago. And I know that there are cousins on my mother's side, that one that is in recovery, two that they are functioning. But again, if we can explain that, because this is a family disease.
Right.
Right now, I'm helping a sister with a 35-year-old brother that is seriously addicted to meth, and it's been going on for years. But mom is enabling, because mom keeps saying yes and lets him keep coming back, or keeps giving him money. So understanding those pieces, especially as kids get older. Certainly, if you are, you know, if all of a sudden there's money missing, or things like that, those things need to be talked about. But for kids with disabilities, it is much more vulnerable for them to be in those situations, because I really think they want to belong. And that's where you need to know what are the situations, and to make sure that even the teachers at the IEP meetings, you know, if something looks off or they're hanging out with somebody, I want to know that information, because I've got to protect them and I've got to give them more information. And we all know that everybody's brain learns in different paths,
Right.
and we may have to figure out how to help them understand that, and that maybe that friend isn't really a friend.
Right. Yeah, and I know my daughter's experience was very much, she needed additional help in school that she wasn't receiving.
Mm-hmm.
And then it just, like, she was not doing well in school, and then this just kind of started spiraling.
Well,
Um,
and I think and Love, that's a really good point, because now how many years ago was that?
um, I was thinking about that. It was probably about 2015
Right.
when I,
So that's almost 10 years ago. But
yeah,
see, that's where I think as parents, because these IEPs are parental, you know, input is paramount.
yes,
And it's sort of like, okay, are we checking other things? And if this is happening and you think that they may be experimenting, then teachers, can you be on our side and figure this out too? So this is where, you know, it takes this team, but sometimes I get concerned that maybe the IEP is here and then what's really going on is here. And it really needs to all be together. I mean, when we
right,
started looking at bullying, so bullying, you know, it was sort of, okay, they might bully on the bus or they might bully outside. Well, guess what happened when the phone happened? It all came
right,
together. And kids don't stop something and say, oh, I'm only going to do this at home, and then I'll be whatever I'm supposed to be in school. That doesn't happen. Everything is, you know, it's just, it moves through space and it's all connected. So,
Absolutely.
and there could be opportunities that, if, coming to these community conversations, bringing your teen, your preteen to them, and then saying, okay, we're going to start this conversation and we're going to have to do it many, many times, because there are people out there that it doesn't matter if you have a disability or not. They want to get somebody hooked in because they might be actually selling it.
Right.
So that's the other piece. I mean, we have to look at the whole thing, because it is not that simple anymore. It's
No,
easy for kids to talk to each other without being in front of each other.
absolutely.
Yeah.
Absolutely.
Any other questions?
See any. Nancy, once again, I just want to thank you so much. I
Well,
do think this is such an important
yeah.
topic, and parents really, I mean, I think that sometimes you as a parent of a child, another child with a disability, sometimes you're focused in so much on that, you
Hmm.
forget that there's all these other outside things that can also happen.
Right. Right. And
Um,
the thing is that if you see this, then I truly believe that the team at school also has to know this,
right,
because the other piece to this is, if your child is on medication for certain things because of the disability,
right,
then the doctor needs to know, because all of that interacts together and all of that can just turn everything upside down.
right.
So that's a really important point, and it really is about conversations and starting early and often. I can't say that enough. Because sometimes elementary school parents go, well, I really don't have to know this because they're in elementary school. I said, yes, you do. You really do. So that you
Yeah.
can have a open and honest conversation about, and the other thing is that two more things. One is, we have these bags. I don't think you can see this. It says doTERRA on it. So in Roanoke, you can get them from us. So these are bags if you want to get rid of your medications, get them out of your house without waiting for the next 6-month take back, which the next one's going to be October 28th nationally. You can go
Okay.
to any of the sites. And I know they have this all over the state of Virginia. It is national. We will have at least 6 to 8 sites between the city and the county and Salem. But we have these bags. You just put the pills in there, you fill it with water, you shake it up and throw it out. And they're called doTERRA. And Love, I can get them to you.
Okay.
We've got plenty of them. We will have them at the community conversations in Roanoke. And then the other thing, just because there are other people in your family, everyone should have Narcan. Everyone should be trained in Narcan. It is like an AED. You could save someone's life and help them get to treatment. So we don't know about this fentanyl. We know that it's an opioid. It is taking at least 3 to 4 nasal shots up the nose, which is the Narcan. It's also called naloxone. We will have rapid revive training. You walk out from the community conversations with it. You can carry it in your car, just keep it in a cool place. And it's one of these things that you really could help save a life. Now, the other piece to this is people that have elderly parents. I use this example because it's a good friend of mine. She now is with Blue Ridge, but she was with the schools, and we've known each other a long time. And we were in a group, and she said, "Oh, I got to tell you about my dad, because he has medication that could put him into an overdose." And so she went to check on him. He's in his 80s. She said, "Okay, Dad, where's the Narcan?" And he said, "It's in the safe. They told me to put it in the safe." The problem is she said, "Dad, I have no idea what your combination is. So by the time I get there, I might not be able to help you." So, but having these conversations, even if you have older people or even people that that have to be on opioids for some reason, it
Right.
is really, really good to know that Narcan will help if there was an accidental overdose and it wasn't, connected to addiction.
Yeah,
So,
absolutely. I think I just read a story. not too long ago about a woman that saved somebody's life in a
Yeah.
Target parking lot.
Yeah, yeah. I mean, it's really true, and it's really easy because they used to have that look like the EpiPens. Right now, it's literally the nasal, and and in fact, I just saw on TV a couple. I don't. They were definitely using substances. They had their little 8-week-old puppy. He got either he sniffed it, fentanyl. The puppy was given Narcan, and the puppy's fine.
Oh my God.
Yeah, I mean, and to be honest with you, if you use it, it's not going to hurt. It doesn't hurt animals. It will not hurt a baby. If it gets used and it wasn't an opioid because it only works on opioids, it's not going to hurt anybody. So just having that and knowing you could save a life is very important.
Absolutely. Absolutely. Well, thank you again.
You're
Thank you
welcome.
for all that you do. And everyone, I will be sending out an email tomorrow to everyone with all of the resources on it. And it'll have Nancy's information as well as mine. So any questions that you have, please feel free to reach out. Thank you guys so much for being
And
here.
yep, and love, the first community conversation will be in Roanoke October 3rd.
Okay.
At Melrose Baptist, which is right in front of Northside High School. We will have a light dinner and it starts at 6. Now, I wish I would have had the flyer, but I've got a couple of pastors that still haven't gotten back to me because we're trying to get at least 4 on the flyer. But just check with me next week and I should be able to send that flyer to you, and then you can get it out to whoever. And I'm sorry that if there's other people in other parts of the state, but if you need to know who a person would be that does this kind of job, I just need to know where you are, and I probably could connect them with the coalition that's in their area.
Okay, great.
Okay.
Thank you so
All right.
much.
Okay. Thanks, everybody. Have a
Thank
good
you,
evening.
everyone.
Bye.